Hey, good morning. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System, broadcasting live with you today from the Dolph Simons Family Studio. We're delighted to be back with you, and I want to thank everyone out there for comments. You know, yesterday we had a session about opening schools, and we had some experts from Children's Mercy, infectious disease physicians, one of our own pediatric psychologists, and you know, it probably generated more questions and more comments than any show we've had or any program we've had. I want everybody out there in our audience to know I've read every one of them.
Yes.
And they're highlighted. Dana and I have taken the time. We've gone through every one of these comments, and they're great, and they're tough, but they're fair, and they're basically saying to us, especially from a teacher's point of view, is it really safe to open schools? You all are talking about the kids, but what about the teachers? What about the faculty? And what about the other people that are there as part of it? So we're gonna address that more today. We're gonna address it both how we're doing it with other businesses, how we've done it here, how we're doing it in Lawrence, and then we're going to talk with David Smith, our expert from our sports medicine program, to talk a little bit about athletics. Lee Norman is back with us today. Lee, thank you for that short notice, because after we looked at these comments yesterday, I said, you know, we got to get somebody else on. Let's address this and take it head on. And who better to do that than my good friend Lee Norman to do it. And of course, Dana, always here with me. And Chris Wilson. Chris Wilson is our VP of System Integration. Chris has spent inordinate amounts of time working with communities, with businesses, and others about how they reopen successfully, and most importantly with KU Lawrence. Chris and I have worked together very closely with the Chancellor and with the University of Kansas at Lawrence, deciding how can we reopen a college campus safely. So these are hard questions, and I think one of the reasons it is so hard is that there's no good answer, right? There is no good answer. You put kids at risk, do you put staff at risk? How do you minimize that risk as best you can? Here's what we know. We reopened a hospital and we don't have spread. And we have nurses taking care of some of the sickest patients at the bedside all day long, because we have cohorted our COVID-19 patients and in the ICU and on the floor, and we don't have spread. We open up our clinics, we don't have spread. But the answer is, what we have done is we've followed the rules of infection control, and we have effective PPE. That's going to be the theme of this morning. Can you reopen schools effectively and safely? And the answer is going to come down, can you follow the rules of infection control? Because if you do, you can stay safe. And we are proof of that, because we've done it, as have other major hospitals here in Kansas City. We have done it, and there's been no greater source of exposure than the nursing staff, the technicians, the other people on the floors who are working all day long with COVID-19 patients and not getting COVID-19. That's the proof in the pudding. But it clearly depends upon safe PPE. We're going to take that question head on. Can schools open safely? So here we go, Dana. What do we look like?
Yeah. Well, it's about the same as yesterday, but that doesn't mean that we didn't have some admissions and discharges. I thought we were going a little bit lower, but today we actually ended up with 36 again. So it's the same number as yesterday, but again, we've had a couple discharges. We've had a couple people that did not, or are now classified as COVID recovered. So we've had some admissions. Unfortunately, of those 36, 16 are in the ICU. We still have 6 on vents, which is really the more concerning thing, because we were at least happier when we only had 2 people on the vents, meaning that there's probably more healthier, otherwise healthy patients who are not needing critical care services and being able to have shortened hospitalizations. But now we have 6 people on the vent.
But even our overall percentage of ICU patients is growing, which I think is what we see. And I don't know, we don't understand this disease all the way yet, but as you look at different communities and their overall population in their hospitals, as their census grows, clearly their ICU proportion grows.
Correct.
And it goes higher than what their census proportion would have been. So it is a real feature of that disease, of the disease. Yep. So I'm going to go to each of our guests, and I'm going to start with Lee Norman. Lee, how are things looking to you across the state, and thoughts about schools?
Well, we have one of the worst states in the country ever since late May, when the counties and cities opened up their doors to party like it's 2019. It's gone downhill, and it's getting worse. And we know how to fix it. This is a public health cannot fix this. This is what the communities have to fix. Schools will not be a safe island in an unsafe community. If you've got a community with bars open, people not wearing masks, mass gatherings, rodeos, county fairs, then schools will not be safe. So I think that people can point fingers at schools, they can point fingers at hospitals and doctors, and that's misplaced. They've got to look in their own communities. If you see one person with a mask on, your community is failing.
You know, Lee, I love you. You just come right to the point and say the truth, and that's it, right? I mean, if people can show social responsibility, we'll be okay. If you don't want to show social responsibility, there's nothing that's going to be safe, whether it's a school, a church, or a funeral, or anything else. It's impossible to be safe if you're not going to wear a mask, right? I mean, that's the answer.
Yeah, I mean, the bottom line is you got to fix your community. There is no safe island for children in an unsafe community. Some of us are old enough to remember when there was no smoking areas in airplanes, and we all got off the plane coughing and smelling like cigarette smoke, even when we were in the non-smoking zone. People need to work with their county officials. They need to work with their public health officials, and they've got to quit doing these stupid things, because we can fix this by September 10th. You know, that's greater than 2 incubation periods away, but not if the people in their communities don't fix their communities. So look inwardly, people. Fix your communities, and your schools will follow as a safe haven, but not until then.
Yeah, I think the message we were trying to give yesterday, I think we said it 27 times, but we said it once, was you can be safe in school, but you still have to follow the principles of infection control. And without those, then you're right, it's not going to be safe. And that's exactly what we were seeing yesterday. That's exactly what we're seeing now, Dana.
We certainly did, emphasize the safety of the students, but we also emphasize the safety of the teachers, because they are important, and the other support and administrators. Public education is near and dear to me. Both of my parents did public education, so I understand that concept, and we need to keep all of those teachers, especially, and the administrators and all the other support staff safe. And we need to go about it the best way, but certainly I think it does start in the community. And what are you able to do? What is that area like?
Yeah, we both come from public schools and Truman High School, Jim Bridger Junior High School, McCoy Elementary School, Independence, Missouri. My mom was the vice president of the school board. This is a really important deal. And Lee, to the point that we also have a public health crisis for kids who are not in school, both for their emotional well-being, their safety, meals, etc. That's a hard thing to balance, but you got to stay safe no matter where you are.
Yeah, I agree, Stephen. We do know that those mitigating measures that you talk about, they do work. They work in hospitals, and they will work in schools. They won't be perfect. The community spreading of the virus, it will drive the safety of the schools. But you're absolutely right. Those mitigating measures that you guys have been talking about absolutely work. I do worry a little bit about schools, and maybe Dana, you might comment. I'm not an industrial engineer, but HVAC systems in older schools, I think, pose a little bit of a problem. They are what they are, but I agree. We can do what we can do, but we have to fix the communities as well.
Yeah, I mean, one of my smarter colleagues, Stephen Waller, could probably speak to that a little bit better. He's got the engineer's mind. But from what I understand, certainly the airflow and HVAC systems and all that in those older schools are probably not as up to date or as efficient as some of the newer things. And that's
if you have a mask on, you're going to limit how much virus you put in the classroom. If you can open the window, that's a great thing. And then, if you don't have a lot of air exchanges, it's harder. But we don't really know what those magic numbers are. And if you look at some of the COVID wards and some of the hospitals around the area, not everybody has negative airflow. And again, I'm just going to say it: we're not getting exposure, or we're not infecting all of our staff who have intense exposures to known COVID patients every single moment of every single day when you work on the COVID ward. And I think that's the take-home message. You can stay safe, but you got to follow the principles of infection control, which is what we say every day. David, thoughts about high school sports?
Yeah, we started high school conditioning and sports back in early June. One of our schools that we contract was right at the beginning of June. And when we look at our experience now through 6 weeks, we're not seeing it spread out on the field. And we've gone out and watched them practice, and it's amazing. The schools that do exactly what you talked about, one school in particular, I won't name the name, but we watched them practice, condition, divide into groups, do some weight training, stay outside. The athletic trainer would put a mask on if they had to evaluate an athlete, and that athlete had to put a mask on. We're doing everything that has been preached now for months. And it's not being spread on the field. Yes, we did have a school with a lot of cases. It was in the news. And that school, started outside of the conditioning fields. It was in a family where there was a father that tested positive, and then 2 of the kids tested positive, and then those kids were in a social circle where a lot of them tested positive, so they had to shut down that school's conditioning for 2 weeks. We've had a couple other schools with an isolated case. And then I look at the pros. You know, I'm involved with the Royals, and we have doctors involved with the Chiefs who will be maybe starting soon. And we look at what happened. They came back with some cases, but as soon as we instituted these principles, boom, we shut it down. And we're not getting cases as they're out there practicing and hopefully being able to play. The pros is different. I mean, this is children and adolescents, and we have a little better control over the pros. But I'm convinced, as we talked last night in our Sports Medicine Advisory Committee for Kansas State High School Athletic Association, we've got a game plan for sports and activities. When we know when school will be started, which looks like it's going to be after Labor Day, when we get the okay, we can do these things out on the field. And I'm challenging the athletes and the coaches to be the example for the rest of the students in the school that you can do it. Look what we're doing. All summer, we've been playing sports and conditioning. We're not fully competitive yet. I mean, there's some sports that are higher risk than others. Yet I'm convinced that we can institute these practices that you described, just like starting the hospital and our clinics back. But it's going to take a lot of work.
It just works.
A lot of work. Yeah.
Chris, we've gone to extraordinary lengths working with KU Lawrence to think, how do we reopen a college safely? Talk about some of that and some of the work you've done with businesses.
Yeah, absolutely. So I think there's 2 domains here we look at. It's the internal to the organization domain, and it's the external community domain. Internal to the organization, I do agree. We can reopen organizations safely if infection prevention policies, procedures, protocols are followed. But the degree of difficulty is directly related to how complex the organization is. When we talk about hospitals, very complex organizations. When we talk about schools and colleges, very complex organizations. And so the key is, do those organizations have the time and the resources to prepare to safely open and make sure that they've got the protocols in place and really the administrative procedures to be able to manage the needs of operating an organization during a pandemic. There's things that you might not be thinking about, like how we're going to manage the timelines for all of our faculty, staff, employees that may be on isolation, return to work, return to classroom timelines. You know, you need people to monitor those things. And so that takes time for organizations to get up to speed on those items. And then would just also reiterate the importance of working with the community and the local health departments. There's only so much an organization can do, and they're going to have to be informed and work hand in hand with their local and county health departments to make sure they're doing the things that they can do to help that community be as safe as possible. Certainly that they don't contribute to spread in that community. And that's been a big priority for ours, and we've been doing this work in Lawrence, is making sure that we partner with the local health department, that we're helping them mitigate spread within the community, and that they're helping inform us about policies and procedures for reopening safely.
Well, and I'd just say, you know, I think it's been a great effort. And what we found is, whether we're reopening athletics or we are reopening the campus, we've been working with Lawrence campus, with the fraternities and sororities, with Lawrence Memorial Hospital, been a great partner, Douglas County, everybody, to try and make sure we keep the students safe when they can come back, and keeping the faculty safe, because there's been a big track of just looking, how do we keep the faculty safe, and what kind of PPE do they have to have in order to stay safe around students. Distancing in the classroom, having simultaneous broadcast, that hybrid model where it's both going out on Zoom and you can come into the classroom, but it's limited and there's only so many kids in a classroom. I don't know how high schools are going to do this. I don't know what the approach will be around that, Lee. But are different schools, to the best of your knowledge, are they looking at how to limit exposures in classroom or limit classroom size, and is that something they should be doing?
Yeah, we've been working with the Department of Education. I think I'm going to meet with them again tomorrow on the plan. We do know, again, that those mitigating factors work. And I think that the response by the schools, hospitals, health department have to be in touch with what the local spread is. Online, without question, online education is the safest way to begin. And if the viral spread in the community is stable or worsening, working towards in-person classes obviously is desired in those communities where there is a dropping number of cases. But I think, you can only staunch the number of cases so far. Like David pointed out, there have been at KU in the athletics, there have been, and K-State in athletics, there's been cases that are positive for COVID-19. But there's no evidence. Matter of fact, there's evidence to the contrary where those infections are acquired. Just in 1 week in Lawrence, there was between 150 and 200 cases, including some athletes, related to 3 bars. And in Aggieville, there was, I think, upwards to 100 cases, which I'm sure is probably a third of the numbers related to what is going on in Aggieville. So, I mean, people can be as careful as they want, and I think that the athletics that Dave was talking about are doing the right things, but then they immerse into the community again and puts the whole team and staff at peril.
All right, so it just keeps coming back to it. Can you play safe by staying safe? And, it's disappointing to me as a healthcare provider that people still want to fight about whether they should wear a mask. It's like, oh yeah, you're my surgeon, go wear a mask. You don't need to wear a mask in the operation. You don't tell the nurses they don't need to wear a mask because I want to have a wound infection and I want to be in the hospital forever. Well, that's a terrible idea. So why do we not think masks keep people safe in the midst of a pandemic like this? It is the most shocking thing to me that we're fighting over something like that, but you would never tell your surgeon, oh no, wear a mask in the operating room when you're opening my heart. I don't want you to wear a mask. Oh, yeah, you do. Right. So it's just, I don't understand that. The way people want to think about it's okay to not wear a mask. Well, no, actually it's not okay. So,
or it's okay to light up a cigarette in a restaurant or a bar.
Yeah, it just at some point you just have to understand that the basic principles of healthcare don't respect political parties. They don't care if you're a Republican or a Democrat. They don't care if you're from Mars or Venus. They're going to be the same thing, and we just have to listen to that. They haven't really changed.
And Steve, we've talked about the mask on the field, and Dana, I know you've weighed in on this multiple times, and that it's uncomfortable to wear a mask when you're working out, no doubt. Yeah, I've done it. It's not comfortable. You don't lose oxygen by putting a mask on. You don't accumulate a lot of carbon dioxide behind a mask, but you sweat in it, and if you sweat in it, it becomes less effective. If you sweat in it, you're going to have to change it. If you're having to put your hands to your face to hydrate, well, there's a risk to the mask. But you're going to have to gel your hands before you remove that mask and hydrate up. We don't want to see dehydration and heat illness occurring out in the field because people are fearful of putting something in their mouth. But it can be done. It's just a new way of thinking.
Yes.
And if you're that far apart, and I know we've talked about is this virus aerosolized versus spread by droplets, and if it's aerosolized, it may transmit further. Well, keep the groups farther apart. I mean, it seems so easy to do.
It is. Well, in 6
but
weeks,
it's hard
it
to
still
do.
work. And even if it is aerosolized, the particles are still decent size if they're really going to be infectious. Small particles don't infect us nearly as much. And so, okay, Jill, media questions. Let's ask. Are there any out there? We have the all-star panel here.
I have this. Taylor from Channel 41. I have one.
Please, go ahead, Taylor.
Hey, Taylor.
I was going to ask about immunizations and vaccinations for students as they head back to school. Obviously, we were telling people this morning it's time to start doing that and time to start figuring out what that's going to look like. Does the presence of COVID and the pandemic change in any way, whether it's more important than normal, different vaccinations parents should be getting for their kids? Any changes to normal back-to-school vaccinations that parents should be watching out for their kids with the pandemic going on?
It's absolutely more important, Dana. I mean, I don't think it can be any question about how important it is. And
more important, we've addressed this since day one when the shutdown came. There was a lot of children who were unable to get their vaccinations. So certainly now we know that we have very preventable diseases with the vaccinations. The vaccinations are going to be more important now than ever, and especially as we move into when the influenza vaccine is available this year, that is going to be important as well. So really advocate and endorse getting those children to their appointments, getting those vaccinations, and any other adults who need catch-up vaccinations as well. Talk to your primary care provider, get those vaccinations, and when flu vaccine is available, get the influenza vaccine as well.
Yeah, and one thing that would be interesting to take is, Innova Pharmaceuticals had some really good results announced yesterday. Actually published yesterday. They had announced them before. But what broke is the United States is going to have 300 million doses of that vaccine in October here in this country. That's remarkable. What's our population? 350 million or thereabouts. And that's only one of the companies, because we've also contracted with other companies to have 300 million doses of vaccine. So that means, oh my gosh, if we can get through to November, December, we'll be in pretty good shape, because I think the vaccination is going to work. But Steve Stites, rose-colored glasses. All right. Other questions? Okay, Jill, let's hear what we have from our listening audience today.
All right, Tom wants to know if the testing for athletes is slowing down testing or results for the general public.
Great question. And let's take that one on. First of all, Lee, what do you think about that? Is testing athletes going to slow down testing for the general public?
I think, well, any amount of testing we do slows down the overall turnaround time because all the labs are getting more and more all the time, and we've seen that, and I know you guys have seen it. Anything that depends on commercial labs with the turnaround is stretching out, which makes it hard. If you get to 5, 6, 7 days, it's hard to use that information in a meaningful fashion to isolate, quarantine, et cetera. So, yes. But that being said, I think it behooves us all then to say, where's the priority testing group and how do we allocate those tests so that we do it wisely? And it's making us think about the decisions we make. If it's a low yield or less important test, should we really be doing it? So I think cautionary tale is we have to watch that until we have unlimited testing, but we're not there yet.
Stuff that got approved for Quest over the weekend and for other labs looks encouraging if your infectivity rate's around 3 to 5% with a 5-to-1 ratio, 4 or 5 to 1. Dr. Norman, talk about that, and we'll turn to Dana around it too, because we think that that's going to help with its ability to do testing.
Yeah. Yes, that's right. It's been approved now, and we need to get more experience with it. But most certainly, pooling, is that what you're asking about, Steve? Pooling of samples, that would definitely help to make it more efficient.
Yeah, I agree, but we are still having, certainly here for the health system, the majority of our testing is still preoperative screening, so people who need these surgeries to make sure that they're COVID positive or negative, as well as any admission that comes into the hospital to keep that patient, the healthcare workers, and other of their family or visitors safe. And then, of course, the symptomatic patients. So that is the great majority compared to the athlete testing right now. I know for some of the other entities, they have contracted with other private labs, so that's a separate issue as well.
I do think the pool testing will make a difference because if you can do 5 to 1 or 6 to 1 or whatever the sampling may be. And so for our listening public, pooled sampling means I take a group of samples together and it's saliva, so it's less time consuming than having to do the swab. You do saliva and you pool it together and you can detect even one person out of that 5 being positive. So if that pool is negative, that all 5 of those are negative, you don't have to test it anymore. And so it gets you through a lot more samples a lot more rapidly, much, 5 times faster. If there is one that is positive, you go back and test every individual one of those samples to see which one was positive or 2 was positive. But I think it's going to be an effective way of doing mass screening, and I think we're seeing it come out, and it's going national now. Many different states are using it, different colleges, groups that are reopening are using pooled salival testing as a way to try and help mitigate that. And we've talked about doing that in Lawrence, Chris, to help with the college and the reopening of the college.
Yeah, that's right. So I think there's a difference between the clinical use of testing for a preoperative patient or a symptomatic individual and large numbers of individuals that we're screening that, in the situation for Lawrence, what we're calling a mass migration, where you've got 20,000 some individuals that are coming back into a community of 80, 85,000. And what can we do to identify and isolate those positives as early on as possible? In fact, even before they actually move into their dorm or move into their fraternity. So that's the kind of different perspective. We're trying to capture more positives across a broader spectrum of individuals that may be asymptomatic or pre-symptomatic, because that's where a bulk of the spread is actually occurring in the community, and being able to get those before we get to the point where a symptomatic individual gets sort of that, what I guess would be called now the traditional COVID clinical test with the nasal pharyngeal swab run on a PCR.
And we just say it like it is.
All right, a lot of people asking about the volume of children in a classroom, multiple classes, one teacher, they'll have 5.
Yeah.
Great that you can spread out on the football field. What do I do in the classroom?
What
and
do
I
we
think
do? That's a great question. And let's
Lori
turn to
asked
Lee.
it really well. She goes, is there a safe number?
Yeah, Lee, it's actually not a question, is there a safe number? Because the question is going to be dependent upon how much space you have in the classroom and how far people are apart. Those are the important variables, and whether people wear a mask. So Lee, what's our approach to public education? A classroom of 30 kids with one teacher. How can we make that safe?
I'm not sure you can, even in the communities where there's spread, but it's a fairly low level. if you have kids within a few feet of each other for 7 hours, I think you can do a good measure with washing and hand hygiene and mask wearing and the like, but kids need to spread out. Let me give you a great example of that. Not kids, but it's my incident command team. We've been meeting every day since early March. We meet in person. We are in a large room. We have stickers on the floor that are 6 feet from each other. We haven't had a single person become ill from anything. We haven't, and I think, and then nobody's been symptomatic to stay home, but we really have to remember to identify symptomatic people and not let them in there. But it's all about space and then those other mechanical kinds of things with mask wearing and the like. So spread out.
Yeah. So if students can't spread out, should that school reopen?
Well, I think it depends in some measure on the amount of disease in the community, and can there be clever scheduling, for example, so that people have perhaps half classes for half days, and or other ways to rotate that space. I'm just profoundly concerned if that kids just have a traditional classroom setting where they can reach across and touch each other, they're going to do that. So I think it's not as safe unless you can spread out and do those other things.
And that's the way we were saying yesterday is still true today. You have to follow the rules of infection control. If you can't follow the rules, and then you can, I think, reopen safely, just as hospitals are reopened safely, athletics is reopened safely, businesses are reopened. But when you can't do that, then you have essentially a bar. And we know that bars are not safe. Mm-hmm. And so if with that being the story, I think that's the key. And so can you stay spread out, David, or are you going to be on top of each other?
Yeah, no, that's what, when you think of our hospital, we have still some meetings and we limit how many people in a room.
Well, look at this. We're each 7 feet apart, so we don't have a mask on right now. When we walk out there, we're around that. In fact, our cafeteria doesn't have much seating left in it. You can't all crowd into the cafeteria. It's all spread out.
And that high school I was talking about that's done such a great job is even doing some weight training, and they rotate through with bubbles groups, and then they rotate out, and they teach them how to clean the machines. You can do that in a classroom. You got to space out. They've talked about innovative scheduling like Monday, Wednesday, Tuesday, Thursday, every other Friday. There's ways that schools will be able to figure this out. Maybe their building can't do this. And I agree, Dr. Norman, it's, the prevalence in the community makes a big difference. If it's a very low prevalence, then okay, it's going to be a little bit easier, but you still have to space out if there's any cases in the community.
Chris, you've worked with some schools as well about this question, and some high schools. And what's that conversation been like? And are people thinking about this sort of staggered scheduling or hybrid scheduling where some are online one day and you're in the classroom the other day, and so you have half the size of the classroom, et cetera? I mean, are people working toward that in your mind?
Yeah, I think all the above. And so, one of we've covered a lot of the straightforward spots about spacing, masking, but I think one of the underappreciated parts of that is even with the perfect schedule and hybrid approach and staggered classes, don't forget about the break room. Don't forget about the socialization at lunch. Don't forget about what you're doing after work. I think we put a lot of emphasis on what to do in the classroom or in kind of the setting that we're all thinking about. But the break rooms, the lunch table, those areas where folks may be letting their guard down a little bit are just as easy of a location to have spread occur. And so it's really about making sure that we have good policies and procedures, but also good buy-in from the individual so that they're keeping that mask on, they're keeping that distance when they're outside of that formal classroom setting. Just
to point out that even though kids, you and I were talking a little bit before the program started, that even though kids may not get as sick as adults, when they go home or they're around their teacher or their staff, they can still spread the disease. And so I think that's a really important consideration because you also have to think, what's your home life like?
Exactly.
And how safe are you there, David?
Exactly. And I think through that, the schools we work with are different socioeconomic classes. They have different parental structures at home, and the ability to do online at home in some communities just doesn't happen. They don't have good Wi-Fi. They don't have the ability to do some of that without direct instruction. So we have to be extremely cautious. I was listening to the program yesterday with Dr. Goldman, and she shared some information in another webinar about the change in their dietary habits now that they're at home, you know, more chips, less vegetables.
Yep.
And an increase in their time on social media as opposed to learning structure, you know, going up tremendously. And then the really sad statistics about the increase in child abuse, the increase in suicide. I was just looking at a study out of the University of Wisconsin where they polled student athletes, adolescent student athletes. 68% of them said they had mild depression during this time where they could not participate in sports. 65% said anxiety was prevalent, and they also said that 25% of that was severe, moderately and severe. And the reduction in physical activity was 50% during this pandemic. You know, that's startling statistics that apply. I know the classroom is the big macro system. Sports is small, but we can learn from some of the things
Yeah,
that
we
we've
can
learned.
learn.
So.
And I'm reminded that when I was in junior high school, okay, that was approximately a very, very, very long time ago, we had split schools. And so I went to Jim Bridger. 7th grade got there between 6:30 in the morning till around noon or 12:30, and then the 8th grade came.
Right.
So 7th grade came in the morning, and 8th grade came in the afternoon, and they had different teachers, different people in the classroom, and that was for a whole different reason. It was back in how many schools we had then.
I think one last thing, and to Chris's point, and to Lee's point about incident command, and your point, when we do meet with masks on, and I think that's going to be important for the teachers and the staff too when they are having their meetings, whether it's in the room, to find areas where you can spread out and wear the mask, because that's going to be important to keep the staff and the teachers safe as well, because we don't want to let our guard down in those
And
situations.
just to say, our lane is, we're trying to tell you how to stay safe.
Right.
Are we the right ones to tell you if schools are open? You got political folks. Thank God for Lee Norman out there
Yes.
doing that good work, trying to make sure that those things are made. What we're trying to tell you is, this is how you can stay safe.
All right, 2 final questions smushed into one. Rachel wants to know, what are the metrics that should be used for opening the school? Like, what is the rolling positive? And then the other one is, Donnie says that some schools are open for the summer session, and she has noticed that the kids are wearing the same mask, they're taking it on, putting it off, on and off, on it. And she wonders how safe that is.
Yeah. So Lee, what do you think about the rolling metrics? What should those look like?
Number one, there's no bright line that says, here's the number, and different parts of the country, different states use different numbers. But what I know what we use in Kansas is, what is the rolling average in terms of the rate of new case development? And if it's going up in numbers, it's bad. If it's level, it's bad. If it's dropping and dropping fast, it's good. Then, as was pointed out earlier, the percentage of positive tests, we're doing much more testing in the state of Kansas, but unfortunately, the percent of positives is going up. We're in double digit now, over 10% in terms of the percentage of positive cases. That's a bad sign. And then finally, hospitalization and death rates. I don't think that's quite as relevant to school kids, but it certainly tells what's going on in a community. So those are the metrics that we use, and we have them available county by county so that people can adjust their thinking that way, because some counties have essentially a zero rate, and some counties are quite high. So you have to pay attention to the local environment.
All right. So, and what was that second question? Did we hit
The
that?
second question had to do with taking masks on and
Yeah,
off in
masks
summer
on and
school.
off. Yeah. How to do that right. And we preach that all the time. There's so many videos online. Actually, there was that one that Sun Yi did for us yesterday, or Sunny did for us yesterday. We ended the broadcast with, go take a look. She is a 7-year-old and did an amazingly great job of showing us how to take masks on and masks off.
Yeah, and I know Chris and I had a phone call with some Kansas City, Missouri schools, and one of them was in summer school doing that. Certainly, it's not optimal practice, it's not best practice, but right now it's the best we have. If you can maintain hand hygiene when putting on the mask and taking it off, it's certainly going to be better than not. And taking it off appropriately, and not putting it on the face mask, but around the ear loops. There are measures to reduce the chance or reduce the risk of problems with that. But right now, again, it's baby steps. We need to change this culture. That's a good step forward, but there certainly is room for improvement there.
Chris, final thoughts today?
Complex organizations schools are, but I do believe if we're able to work with our county health departments in collaboration and provide schools the time and the resources they need, that's why I appreciate Dr. Norman's work, giving the schools a little bit more time to restart to make sure we're doing it safely. But that collaboration between the school and the local county health department and the stakeholders, of course, teachers and parents, I think this is something that we can do. It just takes a lot of effort, a lot of change. and a lot of resource and thought.
Yeah. Lee, final thoughts today.
And to keep your kids and your staff safe, but fix your communities and your schools will follow.
Sports guy over here, but sports, exercise, and activity is healthy physically, mentally, emotionally, and we have to continue to think that way. Let's get these children and adolescents more active. The schools obviously take priority here, but I will continue to push that we've got to get them back getting active again.
Yep.
Dana?
Yeah, again, the school started, that talk started a couple weeks ago. Times are different now. We will continue to really take the best practices, the best amount of data as all of this evolves, and continue to give the best medical advice, as you said, Steve, to really get people to be as safe as possible in whatever setting they're in, whether that's churches, schools, or any other setting as well.
So listen, there is no easy answer during a pandemic, because you see, that's why it's a pandemic. And all of these are hard. They've been hard about hospitals. Do we open or close? Do we have elective surgeries? Do we not have elective surgeries? Schools are hard. And they involve our children, which makes it feel so important to us. Schools are hard because they're staffed not only by kids, really, but by principals and administrators and teachers. And those teachers are exposed to a lot of different kids every day. Those are hard points. So how do you stay safe? There is no perfect answer to that. How do you keep kids safe at home if they have an unsafe home environment? They don't have good food and they're depressed and the suicide rate's high and they don't have good internet access. Their only real social contact is through school. How do you stay safe? And that's maybe one of the hardest questions of our time. And we don't have easy answers outside of what the rules of infection control are and how they can apply to schools. Those are the right answers. Whether schools can act on that, I don't know. I think Leah's dead on. You have to look at it as a community. And if your community can work to stay safe, if people will just wear the darn masks outside of the school, even when they're walking around, you can help the school stay safe. We have to, as examples, we as adults have to set an example for our kids, because if we flaunt it and say it's not true, that we don't worry about masks, we don't worry about gatherings, we go to the bars, then guess what? Our kids are going to mimic that behavior. And we know that. That goes on all the time without a pandemic. Mm-hmm. So if you want your school to be a bar, then ignore all the rules of infection control, and you're not safe, and the teachers aren't safe, and then the public won't be safe. But if you want to work hard at it, you can stay safe. Sure. And it takes the rules of infection control to do that. So we're going to continue this conversation tomorrow. Randy Watson, who's the Kansas Commissioner of Education, will be joining us to help answer your questions, along with Greg Nowalinek, one of our psychologists, who will also talk about anxieties, especially for teachers and parents this time as we go back to school. We also remind you the Community Blood Center has a drive at the Health Education Building today, 7 a.m. To 1 o'clock today and tomorrow. Walk-ins are welcome. Go to savealifenow.org for more details. Wow, pandemics are hard. So what do? You do the next right thing, because that's all you can do. And the next right thing involves washing your hands, keeping your distance, wearing a mask, coughing into your elbow. Don't go out if you're sick. Staying safe. That way we keep each other safe, we keep our community safe, we keep our schools safe. And until we talk tomorrow, just remember, there's still no place like home. We'll be back with you tomorrow. Have a great day.